Good morning everyone and welcome back to Health Horizons. Today we'll be discussing neurodiversity in the workplace and what organisations can do to be more neuroinclusive. Let's start by highlighting why we think this topic should be a priority for all businesses. 1 in 7 people in the UK are neurodivergent, which is nearly 10.5 million people. This really puts it into perspective how many of us are neurodivergent. 51% of employees say they have taken time off work because of their neurodivergence, and only 46% of managers feel capable and confident to support neurodivergent individuals at work, which would explain why so many employees resort to taking time off. More and more businesses are starting to recognise the unique strengths neurodivergent people bring to the table, which we'll get into shortly. But while awareness is growing, providing the right support and workplace environment is still a challenge for many. If we want to build more diverse, resilient teams, understanding and supporting neurodivergent talent is key to unlocking their full potential. Today we've got a really insightful discussion for you that explores the real value neurodiverse employees can bring to organisations. We'll talk about the risks of overlooking neurodiversity and share strategies that organisations can use to better support their people. I'm delighted today to be joined by Kate Hinder, Wellbeing Advisory Lead for Business in the Community. Kate is also neurodivergent herself, so is kindly going to share her lived experience with us today. Morning, Kate.
Morning.
We've also got Dr. Josh Wellman, consultant psychologist for partnerships at Hello Self. Morning.
Morning.
And we also have Claire Maydew, our Group Head of Inclusion at Bupa. Claire leads our strategy to create a global culture of inclusion that enables our people across Bupa to do their best work. Morning, Claire.
Hi.
Okay, as always, please send us through your questions throughout the session and we'll answer as many as we can a little bit later on. We of course have our polls, which I know you love and can't wait for, so we've got a couple of those coming up as well, but there's lots to get through, so let's get started. Okay, so I'm going to come to you, Josh, first. So neurodiversity covers a wide range of conditions. Can you explain why it is so important for organisations to avoid a one-size-fits-all approach?
Okay, so neurodiversity really refers to the natural differences in how our brains function and process information. So different types of neurodivergent conditions include ADHD, autism, dyslexia, dyspraxia and dyscalculia. And this can affect a wide range of abilities. So it could be things like movement and coordination, ability to pay attention for prolonged periods, to process information, etc. And even people with the same diagnosis can have very different experiences. They could have different sets of strengths or challenges that they might experience on a day-to-day basis. So if an organisation takes a one-size-fits-all approach, what you might find is that you're being very supportive to some neurodivergent individuals, but excluding other people with a different set of experiences. So what's really important is to understand individuals and people at an individual level and make adjustments for individuals, but also that can help to inform your kind of broader organisation policy. So really what we want to do is enable people to be open about neurodivergence. And one of the challenges is if someone's had a negative experience in the past, this can result in not being open, particularly when challenges arise. So if we can create this open culture, and that's understanding people's strengths, but also areas of difficulty, then we can get the best out of our workforce. And something that's really important is to use the experience, the lived experience of people that are neurodivergent to inform your organisation policy and culture.
Yeah, okay, great. So I'm really listening to people to form policy, but actually for the line manager, it comes back to understanding their employees, I guess, doesn't it? And really knowing what makes them tick.
Indeed,
yeah.
Just good line management, really.
Yeah.
So,
yeah, cool. So much comes back to that. Okay, Kate, I'm going to come to you next. So we're seeing more and more research on neurodiversity. What are the latest emerging trends and stats that may help organisations better understand a neurodiverse workforce?
Well, first off, everything you said, completely right, absolutely. So I suppose, you know, as you said in your introduction, there's a lot of neurodivergent folk about. 1 in 7 at the minute. I think that number is going to increase significantly because folks are, as folks get more access to diagnosis, and you know, you mentioned stigma, as thinking around neurodiversity and neuroinclusion changes, folks are going to be more open about the fact that they think differently. Me, for example, I'm 54. And I only got confirmation of having ADHD this year. I had to use a private process to do that because the waiting list in my part of the world is 15 years on the NHS. I'll be retired by then with any luck. And that's an experience that lots of women have. There's research that shows that women are less likely to have a diagnosis of neurodivergence, even though they've presented to healthcare services quite a lot. So I think that's going to help us understand more about the ways in which women are different. We also now know that lots of folks who think differently in one way are likely to think differently in other ways. It's called co-occurrence. The University of Birmingham have done this really nice chart that shows the frequency at which different forms of neurodivergence co-occur in people. So, for example, you might have heard of something called ADHD, which is folks who are both autistic and have ADHD. I suppose finally, the really important thing in a business context is if folks aren't able to get access to confirmation of their neurodivergence, and that's the case for lots of people at the moment, you don't need to have that confirmation in place to have reasonable adjustments, right? But you do need one to access medication that could make a big difference to your life, for example, if you have ADHD. So work is a really important place for all sorts of reasons for neurodivergent folk.
Great. So I think we're saying obviously the diagnosis is one thing, but that doesn't stop leaders talking to their people, knowing them, making the role easier for them, etc. That's something that everybody can do.
Of course, absolutely.
Okay, great. Thank you. And Claire, coming to you. So some organisations are recognising the link between neurodiversity and innovation. How has Bupa harnessed neurodivergent strengths to drive innovation?
Yes, great question. I think, like all elements of diversity, when organisations recognise that diversity and difference adds value, you can really realise the benefits that diversity brings. And it's all very well having that diversity, but you can only realise the benefits when you create a really inclusive culture and create an environment where people can be themselves and be their best at work. We've got some lovely examples of that in Bupa. One that I know directly is our group comms team, where they have a real mix of neurodiversity in the team, and the leader of that team has just created a space where they all are very open about their neurodivergence, how they can be their best, what kind of ways we can work together so that they bring their best to work. And it has resulted in really imaginative, quick thinking. They work in a very agile way across each other's projects. And I think we need to see a bit more of that, or that really flexible way of leading teams to get the best out of them. So what we try and do across Bupa group-wide is to provide the frameworks for people to work within. Last year we launched a set of accessibility commitments, and when we think about accessibility, we're thinking of accessibility in its broadest sense, so physical, cognitive differences, and allow business units and countries to flex that in a way that works for their teams, and then provide the practical tools to help them bring that to life. So in Bupa, as you would imagine, we have a big focus on well-being, and our personal energy programme, which is a worldwide programme, provides those team settings for managers to ask questions that they might otherwise struggle to ask, and provide a space for people to share, this is a bit about me, this is how I can work at my best. It might be about neurodiversity, it might not be, but we all have something that we want to share to help us be our best. So it's about creating those environments and the tools for managers to have those conversations.
I mean, I would have thought the best question you can ask someone who works for you is, how can I help you be at your best, isn't it? I mean, there's no downside to that, is there? So, yeah, great, go do it. Okay, Josh, coming back to you. So there's a growing awareness of the link between neurodiversity and mental health. Can you tell us why this connection matters?
Yeah, so statistics suggest that people that are neurodivergent are 2 to 4 times more likely to experience a mental health problem. And some of the common mental health problems that arise might be depression or anxiety. And one of the reasons for that is really some of the stress and burnout that can be experienced in terms of the challenges that someone with neurodivergence might experience when trying to navigate a neurotypical world. So an example could be if someone had a diagnosis of autism and they were in a workplace that was really unpredictable and unstructured, or there was a lot of conflict going on, that could be very stressful for that individual and result in the development of mental health problems. So for some individuals, actually, the mental health problem might be picked up first before neurodivergence. It's quite common, and actually that can result in delays to treatment and recognition. So I think for employers, it's just really important to be able to have open conversations with your employees and provide a culture and environment where people can be open really about their mental health and about neurodivergence. There are lots of really useful benefits that Bupa offer in terms of effective treatments for mental health. And so we can think about talking therapies, for example, that people can get through the Bupa benefits. If we think about work, it can actually be a very helpful thing for recovery from mental health concerns. So employers can play a really important role in supporting people in terms of their overall health as well as their functioning at work.
Great, okay, thank you very much. So lots of support and help there. So coming to you, Kate, research shows that neurodivergent employees can be 30% more productive than those who aren't neurodivergent. From your experience, what other benefits can organisations observe as a result of hiring neurodiverse employees?
So it can be true. Some neurodivergent folks are exceptionally productive, and to your point, it's about the right role and a supportive environment. But as you also mentioned, Josh, living and working in a world that's not been designed with you in mind, it can come at a cost to your health and well-being. So making sure that you give folks your best experience of work is absolutely how you're going to get that kind of productivity and performance out of them. And we mentioned before, didn't we, the pivotal role that line managers can have in brokering that experience. Loads of simple and effective things that you can do that can make a difference to folks. I describe it as living life in hard mode. So there's, as you say, there's lots of really practical things that you can do about communication, just make life easier. In terms of the strengths that neurodivergent folks report themselves, we're talking about empathy, critical thinking, advocacy, resilience. I mean, what modern workforce doesn't need that? Diversity of thought in a psychologically safe team that prevents groupthink, so you get richer decisions, and there's loads of evidence that diverse thinking in organisations and diversity in organisations drives sustainable business performance. So no arguments there. And I guess folks with clear strengths that lend themselves to particular roles in the business, they can make massive contributions. Not everybody has to be an all-rounder in everything, but if you really do have a unique skill set, it would be rude not to, wouldn't it, to deploy that?
Yeah, absolutely. I'm going to go slightly off script now, so just warning you so you can start thinking.
Cool.
So, look, if I'm a line manager, I want to ask everyone how they can be at their best, and they might be neurodivergent or not.
Yeah.
Are there any tips for how you support your people in opening up? I guess it comes back to the environment a bit, but I could imagine for some people who are neurodivergent, they don't feel great about it. It might not be something they want to talk to their line manager about. Have you got any tips that we could share?
So I'm a big fan of give to get. So I think when you're in a leadership position, being, I suppose, candid about your own stuff and the challenges that you face in life, the universe, and everything can really help open the door to folks being vulnerable with you. Yeah. And building a relationship over time really helps. And in very practical terms, I have all my best conversations with my son when we're walking or when we're driving because we're sitting next to each other, not across from each other. Yeah. So we're both facing in the same direction. We're both kind of, it feels less adversarial, and he's neurodivergent, so am I. Eye contact's not our favourite thing. Yeah. So just even something as really simple as practical as that can make a big difference.
Yeah, great. So be thoughtful about the setup, but also show a bit of vulnerability to
absolutely. Be a human.
Yeah.
It's not so hard.
Be a human being, exactly. Any builds, or you don't feel you have to, by the way, but...
I mean, I think for me, I'm a line manager as well as a psychologist, and I just find treating the person as a human, the first 5 minutes of your line management conversation can be about how is the person doing. Yeah. You can talk about personal issues as well as workplace issues. Obviously that is the main focus, but it just helps to make that a regular thing. And so it gives lots of opportunities for people to be able to open up and talk about these things as opposed to it being a one-off once a year or something like that. So.
Great.
Yeah, and I'm also going a little bit off tangent, but I just wanted to pick up on a point that was raised in the question around sometimes we feel that if there's diversity in the team, then the team is going to perform more highly. But there's a risk of putting that burden on the underrepresented group, whatever that is. And so you might feel, oh, I'm the neurodivergent one, that means I've got to make this team perform better. But actually, as a manager, all we're trying to do is level the playing field, so just removing those barriers that they might be experiencing. And I think sometimes we have to challenge that mindset a little bit.
Great, cool. Great, thank you very much. So, I mean, in summary, for our first session, line managers can do so much to support their people, as we know, but have those conversations, create the right environment, show a bit of vulnerability, all key points outside of an actual diagnosis, and you shared the shocking stats around how long that took. Right, it's really insightful to hear those statistics and the impact neurodiversity can really make on organisations, and it's clear that understanding supporting neurodiversity isn't just the right thing to do, it's key to building a healthier and more resilient workplace. So we're going to move on now, but before we do, I know you love a poll, do you think senior leaders in your business recognise the value neurodiverse employees can bring? Yes or no? You'll see that come up on the screen now. Right, next for part 2 of today's session, we'll look at how organisations could build a neuro-inclusive talent strategy for attracting neurodivergent candidates through inclusive recruitment practices to supporting long-term success and retention through tailored workplace adjustments and culture. Okay, I'm going to come to you first, Claire. So from your experience, how does neurodiversity fit into an organisation's wider EDI strategy? And what have you seen companies do well when it comes to embedding it meaningfully?
Yeah, so I think neurodiversity, like all elements of diversity, should be part of your overall inclusion strategy. Sometimes that falls within a broader disability strand of diversity, but that can be quite emotive and subjective for people. But it is really important that it is highlighted as something that the organisation is focusing on. So in Bupa, we have a group-wide inclusion framework that covers inclusive leadership, inclusive practices and inclusive culture. And again, that from a kind of top level, it's a high-level strategy, but it means that we've got practical ways of helping that come to life in each business unit. I think by country, often equality varies by law. So sometimes neurodiversity is not talked about as much in some countries compared to the UK. And where we see some really great practice around this is firstly when there's great leadership support. So a leader speaking out about either their own experience of neurodiversity. In Bupa, we had an insurance leader who talked about a family member who was neurodivergent, and I can't tell you the impact that had for that community to be seen and heard. So firstly having that senior sponsorship, and then kind of joining that with the ground up, so really listening to your people. And like many organisations, we have neurodiversity networks that are led by our colleagues. We have a very active Parents of Neurodivergent Children's network, which is probably the most active because there's so many challenges around education and school for children who are neurodivergent. So really having that top-down and bottom-up approach and raising awareness. So I think there's lots that we still don't understand around neurodiversity, and we need to do all we can to try and make that information available at a time when it's needed. So we do expect a lot from our managers. They have to be experts in everything, at having every conversation. So I think making information readily available and bite-sized so that you can just take what you need when you need it. And by creating that environment, we can start to address some of the systemic change that we need to see in things like recruitment, performance management, promotion, progression, and start to track that with the right data.
Great, thank you. I mean, line managers got so much to remember, but you can have the conversation you would with anyone, whether neurodivergent or not. So.
That's exactly it. Is we're not asking folks to be psychologists, psychiatrists, counsellors. We're asking folks to have human curiosity about what makes their folks tick, so that we can understand how they can then bring their best to work. It's so it's all about that kind of interpersonal relationship. As you say, just that how you doing conversation at the start of a call, how are the kids, and you mentioned kids there, of course that's our future workforce. That's the folks who are going to be our leaders of, well, not tomorrow, but the day after tomorrow. So getting it right for them is going to be how we get it right for our own sustainable future, isn't it?
Yeah, and I think often we see adjustments that have been made for people who are neurodivergent actually benefit the whole team.
Yes.
So sending agendas out in advance, having really clearly labelled calendars, being very clear about what you expect, that's really good for all of us. So
Universal design, right?
Yeah, let us all use that. Yes, inclusive design.
Do some of the basics.
Yeah.
Right, coming to the expert then, Josh. Resilience is key for neurodivergent employees to thrive at work. What role can employers play in helping build that resilience, especially when it comes to navigating challenges and sustaining long-term well-being?
So I think employers can play a really big role, but also employees can play a role as well. So employers can make very simple changes that can make life a lot easier for their employees and get the best from them. So that could include environmental adjustments, and we were just talking about some just there, but that could be things like having quiet spaces that people can work in, so there's less environmental stimulation, less distraction, etc. Allowing movement breaks and not expecting people to sit for really, really long periods in meetings and breaking those up a little bit. It could be things like technological changes, so whether that's adjustments to screens or even thinking about the resources that you're putting out. So if you're using slide decks or documents, the types of text that you're using, for example, or the layout of those can be really important. I think also supporting people to develop coping strategies. So there are various ways to do that. So providing access to things like coaching, therapy, but also self-help resources, and Bupa provide all of those things, can be really helpful for an employee. And that can help to deal with some common difficulties that come up. I'll name a few. So it could be stress, anxiety, procrastination, problems with motivation or perfectionism. And so using these resources can help people to learn strategies to cope. So it could be things like breathing exercises, for example, time management, learning to pace, prioritise, plan their workload differently. And part of this can be learning strategies and then applying this through experience, and managers can support with that too. So I think it's important to try and get the balance, and we've been talking about this throughout today's session, but it's that really clear communication between employers and employee, line manager and line managee. And so that might be not just making these reasonable adjustments, but understanding when that person might want to push themselves a little bit, might want to challenge themselves. So an example could be something like someone with ADHD wants to take on managing a big project for the first time. And so I would ask the line manager to be curious about that. So what things they think they could do well, what strengths do they have to make that a success? Also, what challenges do they foresee ahead? How can they communicate that if it comes up? And what support do they think they need? So having these open conversations is important. And something that I've found personally is sometimes neurodivergent employees don't necessarily know what they need. So you might be learning together through experience.
Great, and I presume where there's like a strategy, it's useful for the line managers to know how that employee is going to work through something, so they can kind of sit alongside them and help them with that. And that'll be a good way to approach it from a line manager perspective.
Yeah, totally agree.
Yeah, cool. Okay, great. Kate, coming to you. So we're moving to recruitment.
Yeah.
Recruitment can be the first barrier to neuro-inclusion. What changes can organisations make to better support neurodivergent candidates?
So I think this, it's a 3-point plan. Love a 3-point plan, and it's really applying a neuro-inclusive lens to current recruitment practices. So I guess the first thing is, are you reaching neurodivergent folk in the first place? So you have to look at your job ads, your descriptions, your supporting information. Are things written in plain English? Are they formatted? You mentioned formatting. Critical, particularly for folks with dyslexia. Do they show the essential skills that a role needs? Not everyone needs to be a team player. Not everyone needs to have excellent communication skills. So really, let's focus on what the job demands. And then I think the second piece is about the selection process. We use observers in all of our recruitment work to make sure, and that's from sifting right the way through to interviews, to, I guess, provide that external perspective to make sure that folks are being treated with equity for all of their characteristics, for all of their identity, you know, and thinking differently, behaving differently is part of that, but not everything. We at BITC, we provide our interviewing questions in advance to everybody. So we're just, everybody gets treated the same. It's just, that's advantageous to folks who are neurodivergent, but it levels the playing field. It's not about specialist. If everybody gets the same and the same is better, then what's not to love, right? Yeah. We also think about using task-based approaches for, as well as traditional interviewing. So I've mentioned eye contact, right? Not everybody loves looking people in the eye. So thinking about what it is you actually want folks to do and helping them demonstrate that rather than how good they are at talking in uncomfortable situations. Be ready to, let folks clarify what it is that you're asking of them. Be ready for that, that's fine. And I guess, we mentioned context previously. I think I have a home working contract because that's how you get the best out of me, because I'm hopeless in an environment that has lots of busyness and excitement. I can't do that. So could it be that an online interview is better than one that's in person? And think about reasonable adjustments, of course, help folks bring their best. And then finally, we're back to managers again. In this case, it's about recruiters and hiring managers. So they need to understand neurodiversity, not at great depth, but enough to understand what neuroinclusion looks like, I guess. Simple thing. If you do unconscious bias training, does it cover neurodivergence? Does it cover different ways of thinking? So it's not complicated, but you need to do this purposefully and thoughtfully.
Yeah, so equity and putting people at ease as well.
Absolutely.
Never thought of sending people the questions before interviewing.
Oh, it's great.
It's
great.
I'd love to get them as well.
But that's it. Nobody loses out, do they?
Yeah. Because you can then, it's all about the conversation recruiting people, isn't it? So if that gets the best out of the individual, then yeah.
Absolutely.
Great. Okay, right, where we go now. Josh, coming back to you. What are some new or innovative neurodiversity assessments and support options that organisations may soon be able to implement?
We've heard throughout today's session that historically people have really struggled to access the assessments that they need. There are long waiting lists, provision is really patchy, but Bupa benefits have really opened up opportunities for people to get assessed in a timely manner and get the support they need. And as Kate was saying, we know that people with one type of neurodivergence are more likely to have another type of neurodivergence than the general population. And so one thing that Bupa have done to recognise this really is to open up the opportunity for joint assessments. So it means that people don't have to go through one process and then wait and go through another process, and it gives them a much fuller understanding of their situation. Bupa do provide a lot of resources on workplace wellbeing, and it relates to what we've been talking about today for line managers. So there's a line manager's guide for working with neurodivergent employees that's just about to come out, so I'd recommend that people keep an eye out for that. Yeah. But also the company that I work for are just about to, or have just been delivering a coaching service for neurodivergent employees. So really it's a strengths-based, goal-focused intervention, and it's designed to promote employee resilience. So people might be just processing a new diagnosis, they might want to learn how to regulate their emotions better, they might want to learn how to communicate better, time management, etc. So it can help people to develop a wide range of skills and to improve their functioning in the workplace.
Great, thank you very much. And at the start, I managed to miss out the introduction. Obviously, you guys partner with us, so so I'm sorry about that. I was so keen to welcome you all. Do you want to do your 30-second pitch for the business?
Yeah. So Hella Self is a virtual mental health provider, and we've just recently partnered with Bupa to provide neurodiversity coaching services. We've started to work with SME, and we're going to be opening up to corporate as well. And people have given very positive feedback so far. So I think historically people have had access to assessments, but then haven't had additional support following on from that, so they've kind of been left in a bit of a vacuum. And it's just been fantastic really to hear some of the responses that we've had, the positive feedback in terms of how people have found this has helped them to improve their functioning in the workplace and just to feel more comfortable at work.
Great, thank you. It's great to partner with you as a specialist and evolve our propositions. So, yeah, helping more people. That's what we like.
Love the sound of that. That sounds great.
Cool, right. Claire, I'm going to come to you next. So how can businesses evaluate the impact of neurodiversity-focused initiatives over time?
Lots of ways. I think just building on what Josh's company does there, we have lots of anecdotal stories of people that have had coaching since their diagnosis, and it is an absolute game changer if you think about people that may have had quite negative experiences in school, university, whatever, and are really trying to come to terms with what does that mean for me, how do I tell my manager, how do I tell my team, so it's really, really valuable. So I think there's lots from an individual basis we can take from that. I've mentioned our neurodiversity colleague-led networks. They're so valuable in feeding back and making sure that you have that two-way feedback loop and creating the safety for people to give honest feedback. We've used our neurodiversity community to consult them on things like improvements to our workplace adjustments process, new products and marketing materials, accessibility of buildings, so new office design. So they're very useful in terms of giving that qualitative feedback. We connect those into a group-wide advocacy forum. So across all of our Bupa countries, we have representatives from our disability and accessibility forums who come together in a quarterly advocacy forum to feedback, okay, you're saying you're doing this, but this is what it feels like on the ground. And my responsibility in that really is making sure that insight gets to the right people, and that, you know, that's hugely valuable too. And then once you've got that qualitative, really trying to build up the quantitative data. In the UK, we can ask questions about disability and neurodiversity on our people systems, and we're starting to see a much better uptake of people sharing more about themselves through those systems. So in an ideal world, you know, you'd be tracking that data against the employee experience and particularly against engagement surveys. So we look at well-being and inclusion indicators from that group of people to see where do we need to take action. So a bit of both and lots of ongoing feedback when you're shaping stuff from the start.
Great, lots of proof points.
Yeah.
Sounds like along the way. So I'm coming to my last scripted question. So I've got a few questions on the iPad, but please send some more in. Now's your chance. And a poll coming up shortly. But before we get to that, Kate.
Yep.
So our last question. Latest research shows that 65% of neurodivergent employees fear discrimination in the workplace. What are the risks for organisations that fail to embrace neurodiversity and support their staff?
Well, there certainly are risks. I mean, just following on from what you were saying there, Claire, the disability rights movement for a long time has had the rallying cry of nothing about me without me. And it's so important to make sure that the voice of folks with lived experience is reflected to the top of an organisation. So I love the work that you're doing with your advocacy. That's brilliant. I mean, I suppose the first thing is the law, right? It's very likely that neurodivergence meets the criteria of a disability under the Equality Act 2010. So in the UK, you really need to be mindful of that. It's a bit complicated because not everybody who is neurodivergent would consider themselves to be disabled. My son would absolutely say that he found the process of school disabling because he wasn't able to bring his best stuff in that context, and the adjustments weren't appropriate for him to do that. So it's important to listen to that, but the law is really important. And of course, there's the loss of talent. There's the loss of great people. You know, if you recruit folks who think differently and you want that difference, then you have to look after them when you get there, because the reputational risk when you get it wrong is substantive, right? And we also know Birkbeck University have done some really good work on understanding the experience of neurodivergent people as well as employers. Career satisfaction is a really big positive enabler of well-being for neurodivergent people. So if you're looking after folks' progression and development, you're looking after their mental health. And that and psychological safety are two of the biggest sort of swing factors that you can control in terms of keeping folks healthy and well who are neurodivergent. So that's really important, right? There's lots of us around. lots of us, I mean, I talk about having been confirmed as ADHD because I find sometimes the language of diagnosis there's sometimes an implication of deficit behind that. There's nothing wrong with me. I'm just different, and that's fine. You know, my difference brings value. But you don't need to have a diagnosis or to be confirmed as who you are. What you do need is help and support that's going to work for you. I suppose, back to the law though, we do see tribunal rulings on folks where reasonable adjustments haven't been put in place, that the business hasn't done everything it could in order to make work for neurodivergent people. And we've also seen folks winning cases about discrimination based on neurodivergence. So the only place really where you can, where an adjustment is viewed as being reasonable or otherwise is at tribunal, and no one wants to go there, do they? Yeah. So don't take the risk. Just get it right for folks. Keep your talent, nurture your talent, everybody, and you'll get loyalty, you'll get performance, you'll get engagement, all the good stuff.
Great. Comes back to knowing your people, doesn't it, and creating the right environment
Always.
for them to flourish. Yeah.
Always.
Yeah. Great. Thank you very much. Right, okay, we're going to go to another poll and then come back to all of your questions. So do you think your organisation provides enough support for neurodivergent talent? Yes or no? Okay, we touched on psychological safety there, which is one of my favourite subjects, Claire.
Love it.
So I'm going to come to you. So how important is psychological safety for neurodiverse employees?
Huge. So yeah, we've done a lot of work on psychological safety in Bupa, and particularly your teams. I think that there's 4 different levels of psychological safety. We were talking about this earlier, and often people see them as you get to one, then you get to, a bit like a ladder. But actually, Kate, and you can elaborate on this, was sort of talking about them more of as a matrix. So really helping people to firstly be comfortable to be themselves. And then you work up to, am I comfortable therefore to challenge when I've got something to challenge? Am I comfortable to innovate and bring new ideas? So as a manager, we have to create the environment for people to move through those stages. So it's not just I can be myself at work, but I can challenge and bring all of my new ideas. We have looked more broadly at psychological health and safety, which goes beyond psychological safety, and there's a lovely Horizons session on that too. And that's really looking at the psychosocial risks. And I think for neurodivergent people, that is particularly important because you often don't feel safe to be yourself, and the stresses that impact others might impact you more. So it's really important to think about psychological safety in the psychosocial way. So watch that previous Horizons discussion if you haven't already.
Yeah, it's amazing. Fantastic host. Yeah,
Kate, I don't know if you want to add anything else on psychology.
Well, it's true. I mean, yeah. So being valued as yourself, being able to learn, and that means making mistakes, right? And for that not to come with being made to look foolish, being punished. Being able to understand what your part in a team is and play that well. And then, as you say, if all of those bits are in place, then hopefully you're in a position where you should be able to innovate, to challenge the status quo, and for that to be treated with, I guess, dignity and respect, and provide real opportunities for folks to do things better. Continuous improvement. We're all about that, aren't we? So if we can find ways of making that work, then we should.
Great, thank you very much. Okay, we're going to change pace a little bit, coming to you, Josh, now. So how important is oh no, I've just done that one, sorry. There you go. Safe environment.
You're amongst friends, it's all good.
Yeah. Can you describe what the assessment is like for an autism or ADHD diagnosis?
Okay, so usually, let's take autism as an example. Often it's multi-part, so there are actually screening assessments you can do yourself online. But so sometimes you might be kind of directed in that area, or if you're having mental health treatment, for example, a therapist might sometimes do a screening assessment with you to try and get an idea. So these have been developed and then aligned with the diagnostic criteria really. So they're quite reliable actually, but they're not good enough really to be able to say you have a diagnosis of this particular type of neurodivergence. So following that, you'll go in for a fuller assessment. Usually what that will involve is an initial session. You might be asked to complete some questionnaires and things like that before. It could be with someone like a psychologist or a psychiatrist or a different allied health professional. And then there are multiple parts to this. So after that first assessment, they've got to know you a little bit. If it's sort of decided that it would be useful to go on for further in-depth investigation, usually it might involve lots of different things. So it could involve actually someone that knows you really well being asked some questions about your history, your past, challenges that you've experienced, etc., your development. But also it can involve doing some tasks as well. So yeah, there could be semi-structured interviews, and you might also be asked some questions about your own history and what you find maybe challenging or difficult day to day. So there's lots of aspects to it, but the reason it's multi-part is because it helps when someone gets a diagnosis that we know it's accurate in a sense. So they'll triangulate, they'll bring together all of this information, and then we know, okay, these things align, and you know,
you can confidence in that,
confident in diagnosis. Yeah.
Great, thank you. And Kate, I don't know whether you'd like to share, but obviously you've been confirmed or diagnosed. So how did it feel going through the process?
Do you know, the funny thing is, when I started the process, actually I was more worried about not being confirmed as thinking differently than I was about being confirmed as different. Because if it wasn't because of ADHD, then what the heck is it? Why is life so hard? Why is life so difficult? So it was, and I explained that to the psychiatrist I saw, and he was like, "Oh, yeah, it's fine. But just as you describe, everything that you just described is the experience that I had. My husband came to one of the sessions as a sort of, I guess, an honest broker of what he sees are my challenges and difficulties, and he ticked a lot more boxes than I did, which is really interesting. But it felt safe, it felt supportive. You get a lovely report at the end of it that kind of, I suppose, plays back what you've heard about, what the people making the assessment have heard about you. And that's really helpful to kind of get that third-party perspective. And then, of course, for some forms of neurodivergence, what that can do is unlock access to treatment, which can be transformative.
Yeah, okay. Brilliant. Thank you very much for sharing.
You're welcome.
Okay, where are we going to go now? So here's a question, just an open question to anyone who'd like to answer it. So neurodivergent colleagues who aspire to progress may not always align with traditional expectations of what a senior leader looks like. How can we evolve our approach to better support diverse leadership pathways? You both take that.
I'm looking at you, Chris.
I mean, yeah, I'm happy to go first. I think we're going to see a lot more of this as more people are confirmed with their diagnosis, and also as businesses realise that we need difference to succeed, and the traditional view of leadership has to change if we're going to survive in this volatile, rapidly changing world that needs constant innovation, challenges to the way we think. So I think there is a switch in what we are looking for in future leaders, which should play into the strengths that diversity brings. But I also appreciate that if you are a neurodivergent person, you often feel a bit misunderstood and might not conform to some of the behaviours that we traditionally see in people that are promoted at work. So I do think it's a real challenge, but I think we are starting to see examples of that change, and that's probably where things like project-based work, having a visible role in a network, or doing really specific tasks where you can shine and show your strengths is really good for people to progress in a way that's not through the traditional, you are a high performer, you go through an interview for the next level, etc. So I think it's challenging the traditional ways of thinking about it.
With the questions shared before the interview.
Yes, for everyone.
There's another add-on to that, I think, which is progression in large organisations is often based on having responsibility for people management. Not everyone was born to be a people manager. So I think sometimes removing the requirement for folks to lead teams. You don't have to lead a team in order to lead a piece of work or to lead excellence within your business. You can be a thought leader very clearly. And so there are lots of ways, I think, in which folk can bring very senior and meaningful contributions. But as you say, you have to think differently about what you prize, and then you have to find different routes for folks to be able to demonstrate how they excel. That aren't always about, for example, behaviours. And behaviours is a really interesting one, right? The expectation of how you conduct yourself in a place of work. Let's have a look at that. Let's understand what, are those behaviours neuroinclusive? Are we creating spaces for folks to bring their best? Or could we just think a bit differently and get some really awesome folks driving the bus?
Yeah, absolutely. Great, thank you very much. Okay, last question, coming to you, Claire. What specific tools help managers to enable neurodivergent employees to thrive when team members will all need something different?
I think coming back to we talked about this earlier where we expect such a lot from managers, and I think it's a really hard job at the moment. So I think as HR teams or as leaders in our businesses, it's about making sure the right tools and resources are available as and when they need them, and that they've got a really clear place to go to. So if they know that someone in their team needs some coaching, oh, hello, this is where I can get that. But also stripping it back to, we're all human beings. You don't need to know everything about me in order to manage me. We just need to be kind to each other and create space to have an honest conversation. And then, yes, we might both need to go and do a bit of work to get the expertise in that we require. But I do think not getting bogged down with the, oh my gosh, I've got to be an expert in absolutely everything. And I think a lot of this comes back to psychological safety. So everything we can do to give managers the questions to ask, the frame of mind to go into those conversations, I think will help everyone to bring their honest selves to work. Thinking about this as a benefit for our future workforce, we've got to be good at this.
Great, thank you very much. Thank you very much to all of you for today. It's been a really, really good discussion. I think my takeaways are, there is diagnosis for people, of course, and policies and so on, but there's so much we can do as line managers to be kind to our people, to understand them really well and help them be at their absolute best before you even get into those areas. It makes such a difference for all of our employees as much as anyone who's neurodivergent. So this brings our session to a close. Thanks for joining us today. Please look out for follow-up resources on this topic, including our Bupa Academy guides and videos and some brilliant content from our partners at Jack. I'm pleased to say that Health Horizons will be returning in November, where we'll discuss tech transformation in cancer care. Thanks for joining, and we'll see you again soon.